What is up, guys? We're back on
Forget About It on Radio Regent.
how is everybody doing today?
I'm doing very well. Thank you for asking. How are you?
I'm doing amazing.
That's good to
It's
hear.
a beautiful day. I think this is gonna be the best day of like weather that we're gonna get for the rest of the year.
Yes.
Yeah, me too. I'm doing pretty good. Today, I actually went to this like film place to develop my summer film, and I'm very excited to see how they turn out.
Yes.
And so the special guest we have today is Laura Hanson from the Regent Park Community Health Center. How are you, Laura?
I'm good, thank you very much. I'm so happy to be here and I'm having a lot of fun already. So.
So we're happy to have you.
So we're gonna talk about a lot of fun stuff today, like COVID-19, because we love COVID-19, vaccination, and social distancing, and all of that. So yeah. So my first question to you, Laura, is: do you have data that you can share regarding vaccination rates among youth in Ontario, in downtown East, or Regent Park and Moss Park?
I do have some data. So we know that in Toronto in general, so that's the data I have. So Toronto people aged 12 to 17, 88% have had their first dose and 82% have had both doses.
That's pretty good.
Yeah. Now the rates are actually lower in the Regent Park and the Moss Park neighborhoods. So Regent Park first doses is 72.5, and then the second doses is 66.4% who are fully vaccinated in that age group. And then also for Moss Park, the fully vaccinated youth is 63.8%. So there is actually a big disparity there. You know?
Why do you think the vaccination rates are lower here? Do you think people are like uneducated or afraid or anything?
I definitely don't think people are uneducated. I mean, I'd be really interested to hear from you guys if you have some thoughts about why those differences may be there. I think, we're hoping to provide some more information for people, but I do think that there's, an issue that comes up a lot is just not quite trusting that this is a safe thing to do, you know? And I think that some communities have a harder time having trust in the healthcare system because of history of not having a good relationship or even having almost an abusive relationship with the healthcare system where people are taken advantage of. So
I think there's a lot of indiscrepancies with youth because I am youth and I hear what the people say a lot.
yeah.
And a common misconception is I was telling you guys earlier before, and my friend was like, oh, the vaccine's magnetic. I'm gonna put, I can connect a coin on it or a magnet on it. Look, watch, I'll show you. And then they posted a video about that. And I remember at the start of when the vaccine came out, everyone was promoting lies and false stuff and try and get people scared.
Yeah.
But luckily, I don't know, I feel our cities handled it very well.
Yeah.
Our country's handled it very well. And I think we're the top country with one of the top countries with vaccination. So I'm really glad because of our youth, because I feel our youth pushed it a lot too.
Yeah, I think so too. But also there's a reason why I think some youth don't want to get their vaccines also because of social media. And there's there's a line between science and pseudoscience. So about that magnetic thing.
Yeah.
And so some people say that the vaccine has COVID in it. So what do you have to say about that?
Okay, that's a very good question. So there's definitely no COVID in the vaccine. The way the mRNA vaccine works, which is the Pfizer and Moderna vaccines, which are the available COVID vaccines at the moment, they have a little code in them essentially that is goes into our mRNA, which is part of every cell that we have. It helps our immune system helps our cells to produce these spike proteins, which are very distinct proteins on the coronavirus. And then what happens is that the immune system responds to those spike proteins and develops antibodies so that you have a little army of antibodies in your bloodstream that can fight the COVID virus if it meets it. So there's definitely no COVID itself in the vaccine at all, in fact. Yeah.
I'm not even gonna lie, I was one of those people that thought that because I took a biotechnology class last year, and that's what we learned. We learned that like some vaccines do have it, but it's not all of them. So I feel like that's something that should be, like.
Yeah, absolutely. And even those are called live vaccines.
Yeah.
And they, the virus itself is weakened.
Mm-hmm.
So
So it's not active.
Exactly. Yeah. So that's a really important thing.
Yeah.
And I've seen a lot of people get pissed off because they're like, I took the vaccine, like I should be 100% like
safe, immune.
Immune.
Yeah.
Like I shouldn't be able to get the virus.
Yeah.
But that's not also how it works.
Yeah.
What's the like immunity that it gives you? I don't know. Do you know?
You know, the statistics are a little bit variable, so it depends on the population that's been researched and like at the time, depending on how much COVID is circulating. But it's upwards of like 95% to prevent like a symptomatic infection. That was, the initial research that we had. I think other data is a little bit less, but so there certainly is the possibility of getting a COVID infection. Mm-hmm. But something that I learned today, or like a statistic that I saw today that I thought was really, really important, is that when we look at the risk of getting hospitalized with COVID, currently like 92% of the people who are in hospital with COVID-19 are unvaccinated.
Yeah.
And 1.4% of all the people in the hospital are actually fully vaccinated. Mm-hmm. So it's much, much, much more likely that even if you get COVID, you're not going to get very sick. Mm-hmm. And you're certainly much less likely of dying as well from those from infection once you've been vaccinated.
Mm-hmm.
Okay, that's sick. As you being like a frontline worker, lately we've been hearing a lot about medical professionals, such as nurses and police officers, and other professional bodies who are not taking the vaccine. If these professional adults are perceived experts, are resisting taking the vaccine, shouldn't youth also be concerned about taking the vaccine?
Yeah, that's a good question. I think it's important to keep in mind that, as you guys were saying, we've done a great job in Canada. 80% of people across the country are vaccinated, which is a really, really high number. And the small minority of people who are not vaccinated at times have like a really big voice, right? So they're out there, they're talking about this stuff. There's actually a minority. It's a small number of people, and an even smaller number, I'm sure, amongst those healthcare providers or police officers, etc. And also I think it's, so it's good to know as well that in some places, like for example in Quebec, I understand that they're talking about suspending the license that a nurse would need to work to be registered if they're not vaccinated, because essentially they're not living up to this, or they're not following the standards of care that would be appropriate for their profession. So I think it's an issue that's evolving over time, but certainly every association or college, like they really are pushing hard for and unions as well are pushing hard for folks to get vaccinated.
Why do you think some medical professionals aren't taking the vaccine?
I'm not sure. I guess, as I'd say, it is minority, and it's very hard for me to understand, because I certainly do believe in the science of vaccinations, and also like I've certainly seen lots of people who are infected with COVID and just see how it disrupts people, and we worry about those folks in the community who may have been vaccinated but don't have the immune response that we would hope for. So, it's hard for me to say why someone would choose not to. I think again though, it's like it's hard to make a big decision like this. Some people, it's a decision that is partly about your own autonomy, your own body, like what you want to put into your body, and that's very important for a lot of people. But I also think it's a decision to make around that is for the health of those around you as well. Mm-hmm. So perhaps those people just like aren't comfortable putting it into their bodies, or don't, for whatever believe the science or trust it. But I have a hard time understanding exactly why someone who offers these, treatments wouldn't want to take it. It is also something that's new. It is a new technology. We're learning as we go. But there's been billions of doses given worldwide.
Yeah.
And so we kind of have this like, huge, if you want to call it an experiment, but it is like, it's a huge mass of people that are, living through this, and we're collecting data on any adverse effects as we go. So I think we're learning as we go. So perhaps they want more information. I've heard that from lots of people. They're waiting for more information, and perhaps that's what they're waiting for too.
Well, I have a question.
Sure.
Let's say there's a youth and their parents are against taking the vaccine. Do you think, do they need their parents' consent, and do you think they should go behind their parents' back and actually take it?
I can answer that part one, and we'll talk about part two, I guess. So in Ontario, in Canada, you don't need, there's no like age of consent. So if you are able to describe, like you understand what the treatment is, you understand what the side effects are, and you understand like what the consequence of not getting that treatment is, you can provide consent for it. Mm-hmm. So you do not need your parents to agree for you to get a vaccination. So, should you go behind your parents' back? Well, what do you guys think?
We're hoping it isn't necessary.
Yeah. But like, I don't know.
Yeah, I had a friend go through this actually.
Really?
Currently. Yeah.
So they went behind
like
their parents'
literally
back.
this month, and then they're like, I don't know if I should get it, and they're in university, so it's like you need your vaccine to go on campus now.
Oh, true. Yeah.
So it's like, do I stay in online school for the rest of my life now, or do I take the vaccine?
Yeah.
So I think they ended up taking it. So yay!
Yeah.
But guys, more of the story is don't listen to your parents. No, I'm kidding. Just get vaccinated as much as possible, guys.
Yeah.
Yeah, I think that, it's actually something I've seen lots is that there's, kind of like discord in a family. Like there's differences of opinions in families.
For sure.
And so, and lots of people get their information and they really trust their families for that kind of information or their extended family or their larger community. So it can be really stressful for people to have that kind of disagreement.
Yeah.
But I think certainly you legally have the option to make that decision on your own.
Yeah.
And I think it's important actually as a young adult to get into the habit of making medical decisions on your own as well, just because this is something that's really important for you to know how to take care of yourself and navigate the healthcare system and stuff like that too. So
along those lines, like some youth think their body is strong enough to fight against the coronavirus without having to take the vaccine.
Yeah.
What do you make of that?
That's a good, really good question. All your questions are really great questions, actually. So I'm sorry if I'm repeating myself. But, certainly with the first round of COVID, so back in March of 2020, when the first original strain of COVID came out, it was primarily affecting older adults and those in long-term care. Since then, the virus has mutated.
Yeah.
So now I'm sure you're familiar with the Delta variant.
Yeah.
That is what everybody is getting now if they get COVID. And the Delta variant is it's very transmissible, first of all. So it's easy to give, it's easy to get, and it affects young people more virulently, it's more strong, when it infects young people and people get sick. So we've even seen, like before we weren't really seeing a lot of children in hospital, like not just youth, but like kids. But in the United States, where there's a lot of Delta, they are seeing lots of kids in the hospital who are quite sick with COVID. So it's certainly something that is, affecting youth. Mm-hmm. The other thing, and I guess I said this before, but you have to think about it as something you're doing for others, as well as yourself. There may be like a friend that you have at school who is on medication that suppresses their immune system or has diabetes, and so they may not be that strong, and so if you give them COVID, even though they've been vaccinated, they may have a worse illness than you would. So
So obviously there's the Delta variant, but do you know if there's just scientifically, will there be more? Yeah,
actually, and that's another point is that even if you don't get that sick with COVID, every time you get infected, you're manufacturing not just more COVID, but actually variants. So every person who's sick has every time the virus is replicating, and there's many viral particles when you have COVID, there's always a chance that it's going to mutate a little bit, and that's going to become a new strain. So that's another reason just to, even if you don't get that sick, to prevent the number of infections.
I did not know that.
Wait, does it mutate because your body is like finding new ways to fight against it?
It's like the virus is trying to get a little smarter.
Oh, okay.
Oh wow.
Damn,
That's
they're
crazy.
learning.
That's actually crazy. I didn't know that.
That's actually scary.
Scary.
Oh my
This is
god.
really, I mean, it's typical for viruses, but often they will get less infectious. They'll get like a little bit
Yeah.
more chill over time. But the COVID virus we're finding is
Persistent.
yeah, and it's
Oh, wow.
getting more like strong and more deadly.
Wow.
Mm-hmm.
But
So-
yeah,
There you
you
go.
can-
You can go.
but Samir mentioned how his friend has to
Yeah.
like have the vaccine for school,
Yeah.
and I was just gonna ask about like the vaccine mandate. Like, do you think that's a good idea? Because I know, like, even in like, for example, like Kyrie Irving didn't get his vaccine. He's a basketball player. He didn't get his vaccine.
Yeah.
And he's not allowed to play like home games in his own city, but he's still allowed to play like in other places. But like, what are your thoughts on like a vaccine mandate?
So you know, it's like a complicated question. As a healthcare provider,
Yeah.
you know, there are times when we use our, like, so most of the time, I want to provide care with your consent, right?
Mm-hmm.
Obviously. But there are times already that exist when we provide care in a way that kind of overrides your consent. So, for example, if someone is at risk of a mental health crisis that could harm themselves or others, we are obligated to have that person assessed by a psychiatrist. So, you know, it's not a light thing to do to mandate someone to have a healthcare treatment at all. On the other hand, I would say that definitely I've noticed lots of people who have been hesitant are getting vaccinated since like the end of August, September, and it's almost entirely people who have need it for their mandate. And actually, we were just talking to someone earlier today who was saying that like they were not going to get it, but they got it for school, and they're glad that they got it. Like, so sort of having to not make the decision on reflection, they're like glad that happened, that they got it. So yeah, because they realized that they had some side effects, which were kind of like, they didn't feel good for a couple of days, and they were like, oh my gosh, what if I actually got COVID? I would have felt so sick. I'm so glad that I got vaccinated. So the other thing is, like, you know, I did expect once kids were back to school that we would start to see a big spike in COVID cases, or like what we call exponential growth. So we have like 400 people for a while, then we have 800 people, then we have like 60, you know, so it like goes up really quickly. But it hasn't. It's sort of been plateauing, and I don't know for sure what that reason is. Yeah, but it's, I think maybe in part because we are kind of reaching, you know, more people to get vaccinated.
Yeah.
I'm not sure if that's why.
Yeah.
I think it's also because we're still wearing masks and doing stuff like that. But
One thing I've realized with school, like most of the kids who decided not to get vaccinated, they're doing online school, and it's mostly the people who are double vaccinated who are at school.
Yeah.
Yeah, that's one thing I realized.
But as of right now, at least in our school board, in the TDSB, you don't have to disclose that information as of now, I'm pretty sure. But yeah.
Yeah, and I guess the other thing is, like, it's always about weighing the pros and cons, right, of a vaccination, like whether it's you as an individual or like the province as a, I don't know, as the Ministry of Health. So, like, I think getting vaccinated also helps us get life back to normal.
Yeah.
And, like, that is so important for our overall health and well-being, right?
Yeah.
So, yeah, I think it's important from that.
It's so scary because we're about to open the border to America.
Oh yeah.
So it's like, get back to normal, but you know, what if we get a spike because all the people coming to visit Canada?
I definitely think there's gonna be a spike. I don't know. I think so.
I mean, at least you could say we got vaccinated, guys. So,
Yeah,
you know?
true.
And the people coming in are supposed to be vaccinated.
Oh, they
yeah.
They're also supposed to do a test.
Oh, that's true. That's true.
I didn't know that.
Yeah,
so
yeah.
now you guys know.
Yeah. Even going there, you have to do a
Yeah.
test. And before you come back, I think. I'm
Yeah.
pretty sure.
Yeah. I can't
Pretty
remember
sure.
the exact details.
Do you think we'll have a booster shot for COVID?
Yeah, I think we will. So currently in Ontario, the people who are getting booster shots are people in long-term care, so seniors living in long-term care, and then also people who have certain autoimmune diseases or certain types of cancer where they're taking medication, in particular that lowers their immune system. So and the reason is, we think that those people don't have a very strong immune response, and so they need a little extra boost. What we believe is that for people whose immune system is working well, like most of the time, then you actually have lots of antibodies circulating that's going to keep protecting you. It may change. So for example, other provinces like Manitoba is giving third doses for healthcare workers, or it may not. The science is still, we're still learning basically about that. Yeah.
What would some of the autoimmune diseases be?
It's a good question. So things like rheumatoid arthritis, lupus, probably certain kinds of inflammatory bowel disease. It's actually based on the type of medication, or people who are taking really significant, there's a type of medication called biologics, but also if you're taking corticosteroids or methotrexate, these are all medications that really kick down your immune system.
So I don't know what a booster shot is. Is that like a third vaccine?
Yeah, totally. Thanks for asking. Yeah, a booster shot is a third vaccine. So what it does is it reminds your immune system. It's here's a little dash of of mRNA for your immune system to produce those spike antibodies, and then your antibodies are woken up essentially, and they're just okay, now we remember what COVID looks like, so that if you meet it in real life, you will respond to it. Does that make sense?
Yeah. So
we get booster shots already, so you may remember in grade 9
grade 8,
grade
7,
and you get tetanus shots when you're a baby, and then you get another tetanus shot when you're 14, and then every 10 years you need to get a tetanus shot.
So it would be like that.
Exactly.
Okay.
Yeah.
Oh, I didn't know that.
So the vaccines they wear out after a while.
Some of them do. Some provide different kinds of protection, but definitely there's ones where you need to get booster shots through your life. Yeah.
So I actually got my vaccine recently, a month or 2 ago.
Okay.
It's kind of the same thing what you said. I didn't want to get it at first, so once I got it, I was glad I got it.
Yeah.
So how would someone, how do I phrase this properly? So would someone who take it later, would that be better? I know you don't want to wait till the latest opportunity, but let's say if you want to put back your booster shot, like you said.
So that's a good question. So for a while we were giving when they're rolling out the vaccines, they started with healthcare workers and I think long-term care. I can't remember now. And then they were doing adults, going down in age, and then they did adolescents. So, and for a while they were spacing it out as well. So you got one dose, and then you got the second dose, 3 weeks or 6 weeks or a couple months for some people.
Yeah.
And so actually, and there was also mixing doses. So there was people were getting AstraZeneca, then they got Pfizer and Moderna. So we've actually found that all of these combinations are really good. So surprisingly, that actually spacing it out a little bit is good. And having the mixed doses means you have a good immune response. So that's really positive. And over time, we expect that the immune system would wane, would sort of decrease, or the immune response would decrease a little bit. So, for example, if you just got your vaccine last month, then your response to COVID, your immune response would be stronger than mine, because I got mine way back in the winter.
It's more
Plus
fresh.
you're young, and so you have a nice, strong immune system. So for those reasons, but exactly, because you're kind of freshly immunized, you're
Nice.
Yeah, exactly.
Nice. I love that. I actually have something that I want to bring up. I don't remember what province it is, maybe Manitoba or Saskatchewan, but they were doing something. They were if you get your vaccine, you're getting entered into the lottery or something. Yeah. And you could win a bunch of money. Yeah. Do you think that's ethical? What are your thoughts on that? Do you think it's smart? because the vaccine percentage of people actually doing it went up a lot,
that makes sense.
15-20%.
Exactly. So if it works, then that's good.
Okay.
Is it ethical? I'm not entirely sure, because I feel everybody who got vaccinated should be put in that pool, right?
Yeah.
To get a draw. That's my opinion personally. I think it was, if if I recall correctly, I think it was Alberta as
Oh,
well as maybe
my bad.
I think maybe Saskatchewan as
Oh.
well. And I think they were in they've just come out of, or they're still coming out of like such a significant wave of COVID. So, you know what? I think in that case, like whatever works is good.
Yeah.
I don't know.
Because it went up by a
think-
lot.
I think the way it should be is like, instead of like refraining people from doing things, it should be like, if you do get the vaccine, like you get plus stuff. Like, you know what I'm saying?
Yeah.
Or like, I think it was like, oh, you get like $100 bill. One of the provinces.
Yeah, I think I heard something like that.
Yeah, you get like $100 if you get vaccinated. So it's like you should be getting stuff instead of stuff getting taken away from you.
Yeah, for sure.
Yeah, no, because some of it was also like scholarship money. That's what I heard for like youth. So I think that's good.
Yeah, I mean that's important. It's also really important for your health.
For sure. I don't know about ethical though. I'm not sure about ethical.
And here in the podcast, we learned that scholarship money is free money. So make sure you
That
do
is-
anything to get that vaccine, guys.
Exactly. So now this kind of goes back to the mandate thing,
Sure.
but obviously now people are like companies, stores, they're asking for proof of vaccination.
Yeah.
So many young people don't have like an official ID, or like that's something that like their parents have and things like that. So how would you show your proof of vaccination if you don't have one? Like how do you get to that point?
So this is tricky. So at the moment, you do need to show your ID, and a lot of you don't have ID. As a lot of other folks don't have ID, like people who may not have like a permanent immigration status. You know, people who are homeless or couch surfing. It's hard to keep track of your stuff, right? So it's an issue for a lot of people, and it is still an issue. So unfortunately, you know, it hasn't changed. But we are doing advocacy around this. So I know I was talking to the clinical manager who talks to other people, like different networks, and this information, like this feedback is going back to the Ministry of Health to say like, this is a barrier for a lot of people. And you know, you would think, because you get the QR code now, right? You would think that would be like, you know, hopefully that would be a little more streamlined so that it would work with an ID. But anyway, so it's not, I don't have a great answer, I'm sorry. But just like that it's on the table, like people are talking about it, just that it hasn't been resolved. Yeah. Because it's a serious problem. Yeah.
Wait, so you need your ID now? So like, if you want to show your vaccination? Oh, I didn't know that.
Yeah.
I was showing pictures off my phone and they just allowed me.
Okay, does that work? Because like I know you get like an email receipt. Does that also count?
Yes, so you can still do the email receipt.
Can I like show a picture ID like on my phone?
Yes. Well.
Oh, it's good because
A picture of my ID.
I need to show my proof of vaccination at the art gallery next week. So because you can also add it to like your phone, like on your card or something.
Yeah.
But I think that's a bit of a process. So.
Yeah. You can. I still have little like pieces of paper that are like falling apart, stuck in my phone. So I'm really. Yeah. You know. Anyway, and so it's still fine. You can still use those receipts if you don't have a QR code yet.
I've seen some people like make it their lock screen.
Really?
Yeah, they like turn on their phone. I like here.
Oh my gosh. That's a great
And it
idea.
works, you know.
Yeah.
You mostly need it for everywhere you go, you know.
Yeah, that's smart.
So.
That's the thing.
And I hate like going in my camera roll. I'm like swiping up, like trying to find it.
And then another question that we had was about like regular COVID testing, because I think some schools have that. Like I think our school, if you need it, there's like a saliva test, like the mouth, like not the mouthwash, sorry, but where you like, you know.
Yeah, you spit. And
you spit,
like
that
gargle
one.
and stuff.
Yeah, that one. So do you think that is a good alternative, just like instead of getting a vaccine?
So I don't see it as an alternative to getting a vaccine. So it's not going to prevent you from getting COVID. Yeah. It's not going to prevent you from giving COVID to someone else, except that it's a good way to pick up COVID a bit early. And so, you know, so that you can like isolate yourself. Yeah. So it probably will lead to like earlier detection of infections, but it doesn't actually keep you from getting infected. So it's not going to like work in that way. Yeah.
So I had another question. Where can citizens of the community, Regent Parkers, go to get vaccinated? Where's the spot?
Question. Do you know where 40 Oak Street is?
Yes, we do.
Yeah. So we have a vaccine clinic every Tuesday at 40 Oak Street. And you can go to the Regent Park Community Health Center website to book yourself an appointment, but you can also walk in. Okay.
That's so good.
Yeah, and there's also a vaccine. So that's only on Tuesdays at the moment.
What time?
It's from 2:30 to 7:30.
Okay.
I think. Yeah. Sorry, we keep changing the times a little bit. So
Tuesdays,
Yeah.
2:30 to 7:30.
Yeah,
You guys
exactly.
pretty good.
And Wellesley Community Center, which is like at Wellesley and Sherburne, also is doing a clinic. You can book on the same website through our RPCHC website, and they have a little bit more availability. I think it's Wednesday, Thursday, and one day on the weekend at least. So those are both great options for you to get vaccinated. Yeah, and it may expand again. The hours may change, that kind of thing.
I had a quick question.
Sure.
For those walk-in clinics, what information do you need if you're a youth coming by yourself?
Good question.
That's a great question. Yes. So even though you need ID to go with your vaccine passport thing, you actually don't need ID to come in. So it's better if you do bring it. So if you have your health card or some other form of ID, then bring it with you. It's just easier for us as we're registering you. But for people who don't have any ID, it's not a barrier. You can still come in and get vaccinated. Okay? And that's all you need to bring in with you.
Okay.
So it's pretty accessible, guys.
40 CRC
Yeah.
building.
Yeah.
2:30,
7:30.
7:30.
Yeah.
Tuesdays.
And then
Tuesdays.
Wellesley Center, that's where I got mine. But for all those Jarvis kids
Yeah.
listening,
Yeah.
Wellesley Center.
They
is
made
a
Wellesley
place.
Center nice. Like, I don't blame them.
Yeah, no.
I'd get my vaccine there.
Oh yeah, no, yeah, that's where I got mine. Period. There was also something else that I was gonna ask, but I think I forgot. It'll come back to me. But is there anything else that you would want to add? Just like anything that we didn't
I
hit?
missed information.
Yeah.
Not that I can think of off the top of my head. I did want to say that we were talking about working, I guess there's a discussion about having clinics at schools. Not sure if it's going to be for the junior, elementary and middle schools, or if it's also going to be in high schools as well. But that is something that you may see in the next little while.
I think that's good. That's even more accessible because it's at school, you know?
Yeah.
Yeah, so we heard that schools are doing regular testing. Is regular testing an alternative to taking the vaccine?
Girl,
So sorry.
Well, one
So
thing
sorry.
about the schools are people always wonder how come there's no actual vaccine clinics at the schools.
Yeah.
Do you have any take on that?
I think what happened last year, first of all, when we were kind of ramping up. So schools were closed. You were doing online schooling, and also all the public health nurses were redeployed. So there are vaccine clinics at schools for the usual routine vaccinations in grade 7 and 8, but they a lot of those staff were doing other work because of the pandemic being so bad. So that's probably why it didn't happen before. Now I think we're talking about it, so we'll see what happens in the future, but nothing's sort of set in stone yet.
Okay, great. All right, thank you so much. We very much appreciate it. Guys, make sure you get vaccinated. That's really important. Gotta keep everyone safe.
Protect yourself, protect us.
the community.
Yes.
Yeah. Thank you so very much. For sticking with us on this beautiful episode. We had so much fun with you guys. We hope you stick with us for next week. Next week, Tuesday, you guys know where to catch us.
Same place, same time for Radio Regent.
Yep, you know the vibes.
You know where to find us.
All right, say bye, Jamie.
Goodbye.
Bye, guys.
Make sure to like, comment, and subscribe. And when you do subscribe, hit the little notification bell so you never miss out on any of our content. If you'd also like more, you can find us on our other social media platforms. And if you want even more, you can look at our website.